This is an extraordinary achievement, and it shows what nations and countries can do when they work together and when sort of hundreds of thousands of frontline workers dedicate their time to this. Back in 1996, when Nelson Mandela launched at the meeting of the Africa Union the effort to kick polio out of Africa, there were 75,000 children that were paralyzed by polio every year on the African continent. And we've reached a stage where we can declare Africa free of the wild poliovirus. The last case of wild poliovirus was on 21 August of 2016, and we're basically 4 years past that date. We normally ask for 3 years without a detection to actually consider whether we can certify a country or region polio-free. So after 3 years, the African Regional Certification Commission has started to look very carefully at the information, at the data of all countries in the African region. And then recently, they've looked more carefully at the remaining countries, including Nigeria. And now they are in a position to certify, indeed, based on very good quality surveillance, and access, confirmation that we have access to the children in all areas.
How do we maintain this gain?
What is critically important is, of course, to vaccinate every single child and strengthen the routine immunization program in all countries in Africa. The problem also is that while we don't detect the wild poliovirus in Africa, the wild poliovirus continues to circulate in Pakistan and Afghanistan. With the current rhythm of international travel, no country in Africa is safe from importation of the wild poliovirus from Pakistan or Afghanistan. So we need to maintain very high levels of population immunity using the good vaccines that are safe that we have available. And too many countries in Africa have not so good routine immunization coverage, and they need to strengthen their routine immunization, their essential immunization program, to make sure that no child ever gets paralyzed by polio.
So now Africa is declared polio-free. Nigeria is no longer a polio-endemic country. What happens now with Afghanistan and Pakistan, the two remaining polio-endemic countries? What is the strategy by WHO to ensure that they also reach the milestone to be declared polio-free?
So WHO, together with all of the global polio eradication initiative partners, which includes Rotary International, of course, as an important partner, UNICEF, Center for Disease Control of the United States, the Bill and Melinda Gates Foundation, is working very hard to support the government of Pakistan and Afghanistan to implement the strategies that have worked everywhere else in the world. Again, here we have had some setbacks in the past couple of years with anti-vaccination rumors that have led to a spread of the virus. Of course, the current situation with the pandemic of COVID-19 has put a hold on some of the activities that we're carrying out in these countries. And so the virus has had time to gain some ground and circulate more. We've resumed activities now. We are focusing on identifying the very local, specific issues that have led parents to not bring their children to vaccination, or for us, have led us or the program to miss a large number of children, allowing the virus to circulate. So there's a lot of communication, better understanding also how some of the communities are mobile and how do they move and how do they operate, ensure that we're going to provide them with an access to vaccination. We also intend to better serve the communities where the virus continues to circulate by providing them services that go beyond just the polio vaccination. We're trying to integrate with other vaccination for vaccine-preventable diseases and sort of see how we can join forces with other actors to provide access to safe water, to a package of basic health services, so that the communities see that we don't only provide polio drops, which of course protects them against polio, but for them, polio may not be such an issue when they're suffering from measles or other vaccine-preventable diseases. So we want to ensure that we sort of come with a broader range of services that these communities really demand and need, so that we can tackle the polio problem once and for all.
Michel Zaffran, thank you so much.
Thank you very much for having me.